The race for a vaccine intensifies as some states gradually begin to reopen, all while new numbers continue to come in on the number of people actually infected by the coronavirus. Here to talk about the latest stats and the ongoing White House efforts is the White House Coronavirus Response Coordinator, Dr. Deborah Birx. Dr. Birx, thanks so much for being with us this evening. Doctor, I want to start at the beginning, because in the beginning it was suggested that the mortality rate would be 5%, and the numbers are so much higher than what we have seen them to ultimately be. But the CDC never used the complete test base to come up with the lethality statistics. In other words, they didn't use that the number of people who would be exposed to accurately consider the number of people who might be affected by COVID and die from it. Isn't that a little different from how the CDC evaluated the flu? Because now as we test people, we know more and more people have it, and the lethality rate is so much lower.
I think we're learning every day about the virus and how it interacts with us as human hosts, and that's been very important to constantly be triangulating data. I think we underestimated very early on the number of asymptomatic cases, and I think we're really beginning to understand that there are people that get infected, that the symptoms are so low grade that they don't even know that they're infected, and we're beginning to see that with the New York studies of their seroantibody studies. So we're really beginning. And in every other country, before they had the antibody tests, all they could really see are the cases that showed up with serious symptoms. And so things are changing on a day-to-day basis.
And doctor, the CDC is mandating that deaths that are affected by COVID be attributable to COVID. So if the cause of death, if someone is in a hospital and say is dying of cancer or has a heart problem, if you've got doctors or nurses wearing the same PPE equipment, who may be transferring the COVID on the skin or in a nasal passage, but it's not in the blood, isn't it unfair to kind of estimate or suggest that those deaths that aren't actually caused by COVID are attributable to COVID if COVID is anywhere in the symptoms of the deceased?
Well, this is a very complex virus, and I want to be very clear. It's highly transmissible, very infectious, and a lot of people have become infected. And what we've known now from the very beginning, if you have comorbidities, if you have heart disease, if you have diabetes, if you have asthma, if you have cancer, if you're immunosuppressed, all of those issues make you susceptible to a much more difficult course. And still we're seeing the majority of the people that we're losing to this disease have those other diseases that you just described. And so I do believe that a lot of the diseases we're seeing in the hospital right now, yes, they may have pre-existing conditions, but those pre-existing conditions are resulting in them having a much more serious course when they're infected with this virus.
All right. Well, Doctor, would you agree that it was initially thought that this was a respiratory illness, or one that primarily affected the respiratory system? And thus, out of the gate, we started talking about ventilators, and ventilators appeared to be the problem, or the part of the solution, I should say. But as we went along, we realized that it affects the blood and the immune system and the kidneys, and so the thinking in the beginning that this needed to be handled with ventilators, and finding that 80 to 90% of the people who went on ventilators ended up dying. Did we approach this with the wrong methodology? Should we have looked to other areas, and did we intubate too soon?
Well, the doctors and nurses that are on the front line, they're watching every patient very closely, and they're watching them for what we call the oxygen level in the blood to really ensure, because that's what you need for your brain and your heart and your kidneys to keep functioning. And so if your oxygen level falls too low and it cannot be kept up with just what we call nasal cannulas or rebreathing oxygen masks, if you can't get enough oxygen from that, then they will intubate the patients. I think it's very important to realize that that early report has been revised that was in JAMA that talked about that higher level mortality that you just mentioned. And it's very variable by age, and it's very variable by length of time in the hospital. And so we're finding younger people of about a 75 to 80% survival rate on ventilators. And so you can't look at just one hospital, you have to look at all the information, but certainly ventilators saved a lot of people's lives because they were having trouble getting oxygen into their blood.
And finally, doctor, isn't it, wouldn't it be a better idea to have those low-risk individuals who are now being isolated, even if they are infected, isn't it a better idea to allow them to go out and at least start to develop the herd immunity that we need? Because they're only going to develop the disease in a very, very mild way. And isn't the herd immunity essential to ultimately getting rid of this virus until, at the very least, we get a vaccine?
Well, the most important way to get rid of this virus is to get a vaccine, as you described. We've always used the term herd immunity when it comes to vaccination. No one would use that term in general in discussing a pandemic and letting a pandemic run out with this level of mortality that we see with comorbidities. We have to remember that in America, we have a lot of people, even young people, with diabetes and asthma and hypertension. And so protecting them really becomes very critical because they can have a very difficult course. And so if we knew everybody who would do well off right immediately, that you could really have that discussion. But we don't know who has pre-existing conditions when we see them on the street. And that's why the president's made it very clear that in opening up America again, there are clear gating criteria and there are really clear phases that every single state needs to consider. And in the bottom line of all of this is every individual still taking responsibility of washing their hands, not touching their face, and if they can't social distance, to make sure that they're wearing a mask, because you wear a mask to protect the other person, because when you meet them on the street, you don't know if they have a pre-existing condition and may be susceptible to a very difficult course with this virus, because we still have to remember that there's 67,000 people that have succumbed to this virus in just 6 to 7 weeks. So when people compare it to flu, flu may have some level of mortality, but it's over weeks and months, not over 6 or 7 weeks.
Okay. All right. Dr. Deborah Birx, thanks so much for being with us tonight.